are experiencing difficulties with viewing the slide deck, if you would send me an email and I'll be happy to forward on the slide deck after the webinar has started. So we will get started.
Well, good afternoon, everyone. I'm Doug Cropper. I'm the President and CEO of Genesis Health System. For my benefit, could we just briefly go over who's on the phone? Okay. Who else? Okay. Anyone else? Just the two.
No, there's Brett with Fluor, there's Texas A&M on the agenda just now.
Oh, okay. So Brett, are you on? Okay. And who was the other?
They've logged in as Texas A&M.
Texas A&M. Anybody on from Texas A&M? Okay, well, we'll go ahead with whomever we've got on. So it's a pleasure to talk with you guys this afternoon. And we think we have something special at Genesis from a fellowship standpoint. And so we're happy to talk with you about it. If you're in the webinar, you can see our mission, vision, and values for the organization. We really work hard to live these. These are more than just words on the sheet of paper. They're really the way we lead and look at the organization. So our mission has existed for a very long time, ever since the founding of the organization 21 years ago, to provide compassionate quality health care for all those in need. Vision, to be a national leader in quality and safety, recognized as the best place in the region to receive care, practice medicine, and work. And then you can see we have a number of different values there, 6 specific values. We're very focused on patient safety, compassion, and we are on what we call a journey to excellence. So these are really key to us in our organization in leading and guiding us and helping us make decisions. So a little bit about Genesis. We are locally governed. We're a 501c3, not-for-profit organization. And we are focused on the Quad City region, which covers both eastern Iowa and western Illinois, kind of bifurcated by the Mississippi River. We have 5 hospitals, 1 additional hospital that's under management, system workforce of 5,000 plus people, 750 licensed beds, and last fiscal year, $550 million in net revenue. We have a large physician group of 200 plus practitioners, and that's growing. And we have high satisfaction in a lot of different areas, patient, physician, and employee. This is what we call our one-page strategic plan. This gives a summary of our overall strategy as an organization. And you can see our journey to excellence here at the top. This is our strategy for a 3 to 4 year time frame. We have, and you can see we repeated then our mission and vision that I just went over a little bit earlier. We have 3 areas of strategic focus. First on the left-hand side is performance excellence, in the middle strategic growth, and last on the right-hand side is population health. So those are the 3 things that we're focused in on. The wheel in the center is our wheel of excellence, we call it, and it highlights the 7 areas where our goal as an organization is to be in the top 10th percentile of performance in each of those specific areas. The reason we have those pictures in the middle, those are pictures, representations of our patients, and we want to make sure that in our strategy we remain patient-focused and community-focused. Down at the bottom, you can see we have a number of enablers: culture of quality and safety, this striving to be a high-reliability organization, seamless flow of information across the organization, and then a talented and dedicated workforce and physician and group of physicians that work in our medical staff. A little bit more about Genesis, and on the right-hand side is a picture of one of our health plexes. Our health plexes are outpatient centers, really mini hospitals without beds, all outpatient services, urgent care, imaging. The one in Moline, a group of about 20 doctors. We have another one in Bettendorf, and then we're building one in West Davenport. So we provide, on the inpatient side, primary, secondary, and tertiary care. Most of the quaternary care from this area goes to the University of Iowa. We have a lot of outpatient services, and we've focused significantly on growth in outpatient over time. And then we have what we call post-acute, 3 different nursing homes, as well as a very large home health agency, hospice, and other services, and we lump that over into our post-acute. We have 3 different nursing homes. We are involved in training. The largest training program we have is our family medical residency, where we have 6 residents per year over the 3 years. We have other training relationships. We actually have a nursing school on our campus that is St. Ambrose University, and then we collaborate with other nursing schools and with other colleges that train health professionals. We do research. We're not a major research center, but we have research as a part of our services, particularly in the area of cardiac and oncology. We have been recognized, if you were on earlier, when we talked about our vision of excellence and our vision to be nationally recognized in quality and safety. You can see some of the things we've been recognized for recently. I'll just mention a couple. One would be U.S. News & World Report, 2 years in a row, named us as the #1 community hospital in Iowa. That's quite a ranking that we're very proud of. GMC Silvis, our main facility in Illinois, was named as the top hospital for quality in Midas, which is about 800 different hospitals, some of the highest quality hospitals in the country that participate in the Midas Collaborative. We've been named as a top 50 heart hospital twice. Been a magnet organization. We're going up for our 4th accreditation there, and you can see some of the other recognition that we've received. We don't really seek after recognition, but we believe it comes as a natural result of focusing in on excellence. This next slide is a little bit about our geography, and we're bifurcated by the Mississippi River. We cover both Iowa and Illinois, so there's a little complexity in being in 2 states. And you can see we just have a number of services, whether they're outpatient services or hospital services, that are in both states across this region. A little bit about the fellowship. So our fellowship is structured for 1 year, and you can see it kind of evolves over time. In the first couple of months, you spend a lot of time shadowing me, getting to know people, meeting with key executives in the organization. Months 2 through 10 are very much focused in on projects, and we always have a lot going on, and so the fellows take responsibility for certain projects, and other projects they serve on a project team. And then the last couple of months, we like to prepare you to land a role within Genesis if you're interested in staying here, and assuming we're interested in keeping you, which has usually been the case. Very rarely have we not had somebody interested in us. Our past administrative fellows have been very successful. You can see most of them are still with us. A couple have left to go to other organizations. Jordan Voigt, who was a fellow from 11 to 12, actually is the president of our largest hospital. He's done very well, and you can see some of the others listed. Down at the bottom, Spencer Hall runs our occupational health area, and the 3 in the middle worked with us for a while, recently have left to pursue other opportunities. In some cases, David Weiser left to go to Colorado because his fiance and he wanted to get married, and it was a good idea to live in the same place for them. And Caleb Sanford moved to be closer to his family. So you can see kind of what's happened with fellows. On the next page, typical fellow responsibilities. We do have, the fellows have specific responsibilities, like at the bottom. They are the support in board meetings, help us run the computer and webinar systems, as well as they have been interim directors of a number of different services, have worked on some really big projects, We have some very big projects going on right now that both of our fellows have been working on. We didn't mention, but we do take one internal in the organization and one external, and we started that last year and plan on continuing to do that. So what makes our fellowship unique? Well, you're very involved in working with me on projects that I work on, daily exposure in meetings and the opportunity to interface with myself and other members of the executive team. Cutting edge healthcare reform initiatives is what you'll be involved in. We've been an accountable care organization for 4 years. Very robust population health initiatives, both ourselves and an alliance that we're in with 4 other organizations in the state of Iowa. An opportunity to gain a lot of hands-on experience, which is something many years ago when I did my fellowship, I really benefited from the opportunity to work on real projects and then the opportunity to grow professionally and develop yourself and your administrative skills in real operations work. Next slide here, you're an active member of a number of different meetings, and you have observation opportunities and a lot of exposure to the board, which is one thing I think that makes this fellowship unique. There's a lot of different fellowship opportunities out there. Very few of them are with systems that allow you to be so involved with the board. So a little bit about the Quad Cities. The Quad Cities is named after 4 cities, Davenport, Bettendorf, Moline. Davenport and Bettendorf are in Iowa. There's Moline and Rock Island in Illinois. And there's a number of surrounding suburbs in addition to these 4 cities, but it's called the Quad Cities. Regional population of just under 500,000 people. Genesis is the 3rd largest employer in the region. We have some major other employers. We have a major military arsenal that is in the area. John Deere is our major kind of Fortune 50 employer in the area. It's a collection of a lot of different other employers like Alcoa. We have the largest aluminum manufacturing plant of Alcoa. So a number of different industries, quite a stable area from an employment standpoint. Next, the application deadline is September 14th, so that's coming up next week. You need to, if you're interested, you need to submit the following materials that are listed there: resume, statement of personnel interest, transcripts, and letters of recommendation to Jamie, who is one of our administrative fellows. And then on the last page here, you can see their contact information as well as their emails. So I think I heard some additional people join us. And at this point in time, we have plenty of time, and we'd be happy, or I'd be happy to answer any questions that anyone has about the fellowship or about Genesis. Who would like to ask a question? Yes. Maybe you could introduce yourself again. Uh-huh. So repeat that last part. What are some blank? I couldn't quite hear the question.
Oh, I'm sorry. What are some tips for them that want you to kind of grasp and understand about the changes that are coming down for the Affordable Care?
Well, the Affordable Care Act is more of an enabler than anything. Obviously, huge changes, like he indicated, both in insurance reform and then in allowing hospitals and health systems greater flexibility to try things, particularly with physicians. And then as a result of general health reform, there's been a lot of other changes. I can tell you the biggest change that's happened from a Genesis standpoint with the Affordable Care Act was Medicaid expansion. Now, Medicaid expansion's not happened in every state, just a little bit more than the majority of states. So what do fellows need to know? Well, I think the biggest thing would be to understand what is population health and how do we make and lead in that transition from fee-for-service medicine to different forms of payment. And what's the impact on a health system when they do that? And how do you stay viable and financially sound while you make this enormous transition in business models? So we're right in the middle of that. In fact, I'll leave this meeting today, this webinar, and go to our Board of Managers meeting for our Accountable Care Organization, and we'll again talk exactly about that. Let me just make a suggestion. If you're not asking a question, maybe you could go on mute. That'll help us have a little bit more clarity on the phone call. So, Jennifer, did I answer your question?
Yes, thank you.
Great. Who has another question about Genesis or something with healthcare?
Can you hear me?
Sure, yes. Tell us your name.
This is Brett Levure from the University of Minnesota.
Okay, I know University of Minnesota.
Sorry, I was having trouble with that phone a little bit.
That's fine. Okay.
Just a quick question about the difference. You said internal and external film. I'm guessing that's Vanessa and Jamie.
Correct.
What's the difference between the two, and is there a difference in the experience at all?
No, I don't think there's a difference in the experience, but just to be specific, Vanessa came to us external to the organization, kind of out of graduate school with a fair amount of experience. Jamie had worked for us for a number of years. Yeah, 6 years, Jamie, in various roles, most of it in the revenue cycle and project management roles. So the internal fellow is really a leadership development program for those people that exist in the organization that are viewed to be high potential. The external fellow is someone who comes to us from the outside, usually out of graduate school. Again, another high potential person. Experience is the same. We kind of divide up projects based on the person's interest as well as their skill set. No difference really in the experience. There's just a little bit of a difference in where the person came from and kind of what their background is. A little bit more experience usually going to happen on the internal side. But everybody that's applying in this experience would be applying for the external fellowship, which is a single opportunity.
Thank you very much.
Sure. What other questions? Someone else was going to ask a question there.
Hi, can you hear me?
Yes, what's your name?
My name is Aisha, and I'm a student at Fox University. I'll be graduating soon, and I'm really interested in this fellowship. My question is that you said that you participate in projects. What type of projects would they be?
So maybe we can go back to that slide, Vanessa, we have Jamie working the computer here. So there we go. We went a little far. Let's come back right there. So here's some examples. Are you on the webinar or are you just on the phone?
I'm on the phone. I'm trying to join the webinar,
Okay.
but my link is not working.
You know, everybody always wants to ask me when the fellowship starts, so like what projects am I going to work on? And I say to them, I have no idea. It's all a matter of what comes up, and sometimes major things come up. For example, right now we have a for-profit behavioral health hospital that is applying for a CON, which we're opposing, and Jamie is completely consumed with that project, as well as me. I'm probably spending 40% of my time on that project. So if you would have asked me 2 months ago, gosh, what would Jamie be working on in 2 months? I would have never anticipated that because it just came up. So they're the real stuff. It's not like we plan these things in advance. Some of them have to do with opportunities that come up. Some of them have to do with issues. Some of them are things we plan in advance, like we're doing an update of our strategic plan within our employed physician group. That we look at in advance. Another one that I think Jamie's involved in, again, has to do with an organization that we manage that wants to have a closer affiliation with us. That we've been looking at for some time. I could have anticipated that would be an opportunity. But for the most part, the majority of projects you'll work on are the hottest, most critical things that are going on in the organization right at that point in time. And we simply really just don't know those, that far in advance, maybe 3 or so months in advance, that this is going to be a key issue. So one of the things you're going to want to do is have Jamie and Vanessa email out to you the documents that we've gone over in the webinar, and then you can see for yourself some of the projects that have been worked on in the past and they've been big projects. I'm just reading again up here based on others that I mentioned, but organizational restructuring of the employed physician organization, really a critical project. Back 3 or 4 years ago, ACO development planning and implementation, service line financial analysis and turnaround planning, contract negotiations for Genesis Health Group. So really big stuff that in some cases the fellow leads, is the project manager, and in other cases they're on a project team. What other questions does anyone have?
Your doctor, this is Chelsea from the state of Birmingham.
Great. We've had 2 people come to us from Birmingham.
Okay, great. My question is, on the website it says that, we have daily interaction with you, which is fantastic. In what capacity is that? Is that kind of like a mentorship, or is that talking daily about what projects are working on?
Well, sometimes we're just going to see each other in meetings, which you're going to be participating in, okay? The meetings, the one-on-one meetings where there's coaching and mentoring and developing, that's either going to happen on a weekly basis or a bi-weekly basis, where we have an opportunity to spend time together, updating what projects you're working on, opportunity to ask questions. So there's a fair amount of interaction. It's not always going to be the same kind of interaction that we're going to have either weekly or bi-weekly when we have the one-on-one meetings. But there's always an opportunity to pull me aside after a meeting and say, what happened, or what do you think about this, or what do you think about that? So you're going to see me a lot, and in some cases maybe too much. What else does someone want to ask? Also, when I call up and say, can one of the fellows come down, you're going to get another project, and maybe you're wishing that you didn't get that project, because we're going to keep you busy. Any other questions?
This is Brett again. Just a quick question. What's it like to live in the Davenport area, and how is it with families, and just kind of the general feel of living there?
Well, I think the fellows should answer that, but I'll give my answer too. And we've got Vanessa and Jamie both in the room. One of the very nice things about Davenport is that it is very family friendly, and it's a nice area. We have lots of amenities. It's in Iowa. It's not as cold in Iowa as it is in Minnesota, having lived there for 16 years. It's a nice area that's close to some larger areas. I mentioned it's about 500,000 population. Chicago's 2 to 2.5 hours away. So if you like the big city, we're large but we're not huge, and we're medium sized but we're not small. So it's kind of an in-between market. We have professional teams. We have a professional baseball team. It's a farm team of the Houston Rockets. It's been voted the most beautiful baseball field in the country, actually, right on the river. There's an opportunity to participate in a lot of things. If you like cultural events, we have our own ballet, our own symphony. So, it's not going to be like the Twin Cities, but it's not a small market either. What would you guys say? I mean, Jamie, you've lived here for some time, and Vanessa, you're brand new.
I would say being brand new, I'm blessed to through a lot of activities like running and other sports like that. And I feel like the 2 months that I've been here to be able to participate in several of them, and they're pretty regular. The only thing that I had concerns with when I was looking to come up here was that I had never experienced a winter. So this will be my very first winter, and I can tell you right now, I'm stockpiling all kinds of jackets.
Yeah.
In preparation for that.
Which is a good idea. Maybe before we have Jamie answer, whoever just came on, if you could mute, because otherwise we get a lot of interference on the phone. If everybody could make sure they're on mute. Jamie, what would be your answer to what's it like to live in the Quad Cities?
Well, I am born and raised in the Quad Cities, and it's going to be hard to remove me from the Quad Cities, and our big big advocate for the Quad Cities, so I have been showing Vanessa that, albeit that we are not large, that we have plenty of things to do. So if you do like to the small town feel, we have a lot of small towns having festivals and such going around, but we also have large venues like the Iowa Wireless Center where very popular artists come.
Taylor Swift.
Yes. So we have a
Eagles.
bit of everything. So if you can think of it, we probably have it, and if not, it's within driving distance.
Yeah. Yeah, good answer. Anybody else?
Thank you.
Schools are very good, very highly rated schools here, which is pretty typical of the Midwest. Really highly rated public schools, if you have children in school. Any other questions?
Thank you. Thank you.
Hi, we have some feedback, so why don't you try it again? Yes, what's your name? Really tough to hear your question. I heard the professional development part, but I didn't hear the list. Did either of you guys catch that?
She was on HFMA.
Oh, attending something. Okay. Yeah, so let's talk about that. People can attend that are in fellowship as many of the local educational things as they want to. I have them pick one national conference that they want to go to, and we fully fund it. I'm a big believer in education, and we have a lot of education that we do here. On a quarterly basis, we bring in a big-time speaker. We just had David Hessenbaugh, who wrote a couple of books on trust, come in. And so you get the opportunity to participate in the leadership development that we do internally within Genesis, as well as there's other leadership development that we do here. And you can participate with, like I say, regional educational sessions and attend one national conference. So, good question, actually. Anybody else? Well, maybe let's just wrap up. I guess in the end, what I would say is this: my career was boosted and turbocharged by having an outstanding administrative fellowship. I was administrative fellow with an organization in Minnesota when it was merging with another organization. There was a lot going on, and I've always greatly appreciated the opportunity to be in such a great fellowship. And I've worked hard over the years to try to develop an experience here in working with me that's unique to frankly give back to the industry and give other people the same opportunity that I had. And a lot of that just comes with working on real projects. Now, I think I'd have to count it up again, but I think Vanessa and Jamie are my 20th and 21st administrative fellows. So it's not like this is my first rodeo. I've worked with a lot of administrative fellows, some of which have left and come back to work with me again, just because it's a small world. So we believe we have something very unique. It's a great organization with a lot of opportunities. We'd encourage you to put your application in. We are pretty competitive. Every year we have well over 60 to 80 applicants for the single fellowship. But if you believe you're an excellent candidate, I'd encourage you to apply. And we'll just see what happens. And we look forward to reviewing your application. And I wish all of you the best of luck. Thanks for joining us today.